الله الرحمن الرحيم الحمد لله والصلاة والسلام على رسول الله صلى الله عليه وسلم. Today we are going to talk about nerves of the lower limb. This talk pure in English for our student in India. So we are going to discuss and to describe nerves of the lower limb. This is the learning objectives. We have to memorize. We have two plexuses. The first plexus is called the sacral plexus, and the second plexus is called the lumbar plexus. The site of these plexuses in the abdomen and in the pelvis. From lumbar plexus, we have two important nerves. They are named the femoral and obturator nerves. Femoral and obturator nerves. And from sacral plexus, we have sciatic nerve. These three nerves are nerves of the thigh. So in the thigh, we have three nerves. They are named the femoral for the anterior compartment, obturator for medial compartment, and the sciatic nerve for posterior compartment. In the popliteal fossa, sciatic nerve is going to divide into two branches. They are named the tibial nerve in popliteal fossa and the common peroneal nerve. So we have two nerves in the popliteal fossa. They are named the tibial nerve in popliteal fossa and the common peroneal nerve. In the leg, tibial nerve in popliteal fossa is going to continue and it change its name and it becomes a tibial nerve in the leg. While the common peroneal nerve divides into two branches, they are named the superficial and the deep peroneal nerves. So we have three nerves. One for the anterior compartment is called the tibial. One for the anterior compartment is called the deep peroneal nerve. One for lateral compartment is called the superficial peroneal nerve. And finally, one for the posterior compartment, which is called the tibial nerve in the leg. So simply speaking, when we are going to organize our knowledge, we have two plexuses, lumbar and the sacral plexuses. And we have to know we have 8 nerves, 3 in the thigh, 2 in the popliteal fossa, and 3 in the leg. 3 in the thigh, femoral obturator and the sciatic nerve. 2 in popliteal fossa, tibial nerve in popliteal fossa, and the common peroneal nerve. And finally, 3 in the legs, they are tibial nerve in the leg, superficial peroneal nerve, and the deep peroneal nerve. Simply speaking, when we are going to simplify this knowledge, we are going to talk first about lumbar plexus. Lumbar plexus, this plexus in the abdomen. It's a site in the posterior part of psoas major. This muscle with orange coloration is called psoas major. If we are going to remove this muscle, we are going to find plexus, and this plexus is called lumbar plexus. It is formed of L1, L2, L3, upper part of L4. And simply speaking, we have about 6 branches or 7 branches arise from this plexus. They are named LU hypogastric, LU inguinal. LU means L1. LU hypogastric, LU inguinal, hypogastric and inguinal, they are regions. LU hypogastric, LU inguinal, genitofemoral nerve from L1 and L2, and lateral cutaneous nerve of the thigh, L2, L3. And we have 2 branches. And both branches, the roots are L2, L3, L4. They are named the femoral and obturator. So finally, we have 6 branches. LU hypogastric, LU inguinal, genitofemoral, lateral cutaneous nerve of the thigh, femoral and obturator nerve. And occasionally, we have other nerve, which is called accessory obturator nerve. From this plexus arise 6 branches, but what concerns me is 2 important branches in the lower limb, one for the anterior compartment and one for the medial compartment. The one for anterior compartment is called the femoral, and the other for medial compartment is called obturator nerve. So femoral nerve origin, root value, L2, L3, L4. This nerve passes between psoas major and iliacus. The muscle with baby blue is called the psoas major, and the muscle with greenish coloration is called iliacus. And this picture in the abdomen, and this part in the leg, in the side. So the nerve passes in the gap between psoas major and iliacus, then passes behind this ligament. This ligament is called the inguinal ligament. It enters the thigh and finally divides into superficial and deep branches. Superficial and deep branches in the relation to this artery. So we have femoral nerve passes between psoas major and iliacus, deep to the inguinal ligament, and finally divides into superficial and the deep branches in relation to artery. What are branches of femoral nerve? We have 4 muscular branches and 3 cutaneous branches and 2 articular. So try to remember 4, 3, 2. 4 muscular branches. Number 1, we have to this muscle. This muscle is called the sartorius. And this muscle is called the quadriceps femoris. In particular, 1 branch for each head of the quadriceps femoris. And the number 3, we have branch to pectineus. This muscle is called the pectineus. And finally, 1 branch for iliacus. This branch arises before the femoral nerve enters the thigh. So we have 4 muscular branches. Number 1, iliacus, this muscle. Number 2, pectineus. Number 3, sartorius. Number 4, quadriceps femoris. So we have 4 muscular branches. Iliacus, pectineus, sartorius, and quadriceps femoris. We have 3 cutaneous branches. Number 1, this branch, which is called the medial cutaneous nerve of the thigh. And this branch, which is called the intermediate cutaneous nerve of the thigh, for medial and the front of the thigh. Try to remember the lateral cutaneous nerve of the thigh arises from lumbar plexus per se. So we have 2 branches, medial cutaneous nerve of the thigh and the intermediate cutaneous nerve of the thigh. And we have branch, which is very strange, because this branch is called the saphenous nerve. It's a name because it accompanies great saphenous vein. And the distribution of this nerve to the medial aspect of the leg, medial aspect of the foot, but it is not going to supply the big toe. It is stopped at the root of the big toe, at the metatarsophalangeal joint of big toe. So we have 3 cutaneous branches. They are named number 1, medial cutaneous nerve of the thigh. Number 2, intermediate cutaneous nerve of the thigh. Number 3, saphenous nerve. Finally, we have 2 articular branches. These branches accompany the muscular supply for quadriceps femoris, one to the hip joint and the other for the knee. So we have 4, 3, 2. What about injury of the femoral nerve? Stabbing injury, for example, or shoot injury. If we have injury to femoral nerve, we have paralysis of 4 muscles. 3 pass unnoticed, sartorius, pectineus, iliacus. The injury of these muscles pass unnoticed. We only observe, we only see the injury of quadriceps femoris because this muscle is the only extensor of the knee joint. So if there is paralysis of quadriceps femoris, the patient develops inability to extend the knee joint. There is wasting of quadriceps femoris, weak flexion of the hip, but the most important point, inability to extend the knee. About the sensory supply, we lost sensation over the front and the medial aspect of the thigh and over the medial aspect of the leg, including the medial aspect of the foot. This area with greenish coloration. This is the injury of femoral nerve. Number 2, we have obturator nerve. Try to remember, from lumbar plexus arise 6 branches, 2 for the lower limb in particular, very important for us, femoral for anterior compartment and obturator for medial compartment. Both obturator and the femoral have the same root value, L2, L3, L4. So both of them arise from L2, L3, L4. This nerve comes through this foramen or this canal, which is called the obturator canal, and shortly after entering lower limb, it divides into 2 divisions, anterior division and the posterior division. Anterior and the posterior to what? To this muscle. This muscle is called adductor brevis. So it has anterior and posterior division. What about the supply of this nerve? This nerve is going to supply muscles of the major compartment of the thigh, except one piece anterior, one piece posterior. I mean that it's going to supply pectineus. About this pectineus, there is, I told you before, this muscle is supplied also by femoral nerve. So this muscle, there is some studies states that it is supplied by femoral, and some studies state that it is supplied by obturator, and there is other studies state that it is supplied by both nerves, femoral and obturator. So pectineus, there is matter of discussion about this muscle. So I put here exclamation mark, question mark, to notice that it is supplied maybe by obturator, maybe by femoral. Again, this nerve supplies pectineus, adductor longus, the yellowish and the bluish muscle. Then after that, adductor brevis, this part, pubic part of adductor magnus. It is not supplying ischial part of adductor magnus. So this muscle, this nerve obturator supply muscles of major compartment. Beside this muscle, which is called the obturator externus. This is one of the 6 lateral rotators. So finally speaking, it is supply all major compartment except the ischial part of adductor magnus. Beside, it supplies obturator externus muscle. About the cutaneous distribution, it supplies the medial aspect of the thigh. Try to remember, medial aspect of the thigh is the skin of the medial aspect of the thigh supplied by both obturator and the femoral nerve. And both cutaneous branches form together what we call the subsartorial plexus. So this is the final distribution of the femoral nerve and the obturator nerve, the cutaneous distribution of the femoral nerve and the obturator nerve, and both of them originate from lumbar plexus. So this is a part of lumbar plexus and the nerves of lumbar plexus, which concerned with supply of the lower limb. After that, we are going to continue. So we finish this piece, lumbar plexus, femoral nerve, obturator nerve. We are going to return to this piece, sacral plexus. About sacral plexus, this is plexus in the pelvis. It is formed in front of sacrum and the piriformis. This is the sacrum, and this muscle is called piriformis. It is formed on L4, L5. This is called the lumbosacral trunk. S1, S2, S3, upper part of S4. It is formed in front of sacrum, in front of piriformis. The root value or the origin of this plexus or formation, L4, L5, S1, S2, S3, upper part of S4. What about branches of sacral plexus? In short, from the plexus before its division, the plexus is divided into 2 division, anterior posterior division. Before its division, it gives 6 branches. 2, 2, 2. And all these branches, the first initial is P, P, P. So it is called the 6 P's. P, 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 P. 2 branches for pelvis, to nerve to piriformis, and the pelvic splanchnic nerve. Pelvic splanchnic nerve, this is the important parasympathetic supply. So PP, piriformis, pelvic splanchnic nerve. 2 branches for the lower limb, and both of them are cutaneous. Posterior cutaneous nerve of the thigh with perforating cutaneous branches. Both of them cutaneous. And the 2 branches to perineum. Perineum, the region corresponding to the outlet of the pelvis. Pudendal and the perineal branch of S4. So we have 6 P's. 2 P's in the pelvis, piriformis pelvic splanchnic nerve, 2 nerves in the lower, and both of them cutaneous, perforating, because it's going to perforate this ligament. It's called the sacrotuberous ligament, and the posterior cutaneous nerve of the thigh. And the 2 branches for perineum, pudendal, and the perineal branch of S4. We have 3 branches for anterior division, and the 3 branches from posterior division. 3 branches from posterior division above and below piriformis. This is called the superior gluteal and the inferior gluteal. And the 3 branches from anterior division, nerve to quadratus femoris, this, nerve to obturator internus, this. And the nerve, and this nerve arises from both anterior and posterior division. It's called sciatic. It has 2 components, tibial and the common peroneal. Tibial component from anterior division and the common peroneal component from posterior division. So simply speaking, when we are going to discuss tibial nerve, which is our concern here, we have to know that tibial nerve is formed of 2 components, and these 2 components are enclosed within common sheath. What are these 2 components? Tibial and the common peroneal. Tibial from anterior division, common peroneal from posterior division. So sciatic nerve is formed of 2 parts, tibial and the common peroneal. These 2 components are enclosed within common sheath. Sometimes the 2 components are not enclosed within the common sheath. They are going to come separately. This sometimes occurs. Shortly speaking, simply speaking, sciatic nerve comes out and leaves the pelvis through foramen, which is called the greater sciatic foramen. This foramen is called the greater sciatic foramen. Below this muscle, which is called the piriformis. So it comes out and leaves the pelvis through a greater sciatic foramen below piriformis. It reaches the gluteal region. Then it passes in the back of the thigh. It passes in the back of the thigh, and in the middle of the back of the thigh, it is going to divide into 2 terminal branches. Actually speaking, the 2 components are going to separate from each other, the tibial and the common peroneal component. What is the distribution or the branches of the sciatic nerve? Direct branches, we have muscular. 3 + 1, 3 hamstring. What's meant by hamstring? The muscle of the back of the thigh. There are biceps femoris, semitendinosus, semimembranosus. This muscle is called biceps femoris, and semitendinosus, semimembranosus, plus ischial part of adductor magnus. So we have 3 + 1. Actually speaking, there is no direct cutaneous branches from sciatic nerve, and there is articular branch for hip joint. So this is the sciatic nerve. But when we are going to discuss this nerve deeply with some depth of knowledge, actually speaking, I know the direct branches for hamstring and ischial part of adductor magnus. But because this nerve is going to divide into tibial and the common peroneal, and the tibial and the common peroneal are going to supply all muscle of leg and all muscle of foot. For example, common peroneal nerve supplies the muscle of anterior and lateral compartment of the leg. Tibial supply the muscle of the posterior compartment of the leg and the muscle of the foot. So these branches are indirect branches. So when we are going to think deeply about sciatic nerve, actually speaking, it has direct branches for 4 muscles, 3 hamstrings, and 1 ischial part of adductor magnus. But all muscle of leg and all muscle of foot indirectly supplied by this nerve through branches of common peroneal nerve, through branches of tibial nerve. The same for cutaneous. It has no direct cutaneous branch. When we are going to speak about sciatic, no direct cutaneous branches. But actually speaking, it gives off tibial and common peroneal. And common peroneal is going to divide into superficial and deep peroneals. So through these branches, it's going to supply all leg and all foot except the 2 parts of the leg I'm going to describe now with the injury of the nerve. So through tibial and the common peroneal nerves and their branches is going to supply leg and the foot muscles and cutaneous supply. This is important for understanding injury of sciatic nerve. What's the cause of injury of sciatic nerve? Maybe bad intramuscular injection, which is very rare. Posterior dislocation of the joint. This is in car accidents. In car accidents, there may be posterior dislocation of the hip joint, and the nerve is directly related to the back of hip joint. So there may be possibility for injury of sciatic nerve in posterior dislocation of the hip joint. If there is injury of the tibial nerve, sciatic nerve, what's the effect? Motor sensory deformity. Motor paralysis of hamstring, ischial part of adductor magnus, all muscles of leg, 13 muscles, all muscle of the foot, about 18 plus 1, 19 muscles. All these muscles are going to be paralyzed with injury of sciatic nerve. Sensation, loss of sensation of leg or foot, except the 2 areas. First area, an upper part of the back of the leg, this is supplied by posterior cutaneous nerve of thigh. Second area, medial aspect of the leg and the medial aspect of the foot, because I told you, because it is supplied by saphenous of femoral nerve. So actually speaking, if there is paralysis of sciatic nerve, complete injury of sciatic nerve, we have paralysis of hamstring, ischial part of adductor magnus, all muscle of the legs, of the leg, all muscles of foot. Cutaneous, we lost all sensation of leg and the foot except the 2 areas, upper part of back of the leg and the medial aspect of the leg and the medial aspect of the foot. The deformity, weight of the foot cause it to assume plantar flexion, drop foot. So we have drop foot, plantar flexion, because this is the effect of the gravity, plantar flexion. It is called the drop foot. This is drop foot. The toes do not clear the ground during the swing phase of walking. This is not normal way of walking. The most important part of injury, it's called sciatica. Sciatica. Sciatica means we are going to compress the root of sciatic nerve through intervertebral disc herniation of intervertebral disc and the compression of the root of the sciatic nerve. This is called sciatica. The patient experience pain along back of the thigh and because back and the lateral aspect of the leg and the lateral aspect of the foot. So this is called sciatica. Sciatica. So we finished lumbar plexus, sacral plexus, femoral, obturator, sciatic nerve. So we finished all nerves of the thigh. We are going to discuss nerves. I'm going to take tibial nerve in popliteal fossa and its continuation is called tibial nerve in the leg. Simply speaking, in modern anatomy, tibial nerve just only. And the second, we are going to discuss this column peroneal nerve, common peroneal, superficial, deep peroneal. So we are going to discuss by component, tibial component and the common peroneal. Tibial, I'm going to divide for simplicity, tibial nerve in popliteal fossa. It begins at the middle of the back of the thigh, towards the termination of a sciatic nerve. It ends at the lower part of popliteus. It becomes tibial nerve in the leg. About the supply, we have muscular and cutaneous. We have muscular and cutaneous. Muscular, the muscle of the back of the leg is divided into a superficial and a deep group. So it's going to supply three superficial, one deep, through superficial, gastrocnemius, soleus, and the plantaris. Calf muscles, it's called the calf muscles, gastrocnemius, soleus, and plantaris. And one deep muscle is called the popliteus. So try to remember 3 and 1. 3 superficial, 1 deep. Cutaneous, we have nerve. And this nerve is called sural nerve. Sural means the calf. And the sural nerve supplies the lower part of back of the leg and the lateral aspect of the foot, including little toe. Do you see this area with baby blue? It is the supply of the sural nerve, lateral aspect of the foot, including little toe. So we have tibial nerve in popliteal fossa. It is going to give us muscular and cutaneous. In particular, it gives us also articular branches that are called genicular nerves. So we have muscular, 3 superficial, 1 deep. 3 superficial, gastrocnemius, soleus, and the plantaris. 1 deep popliteus muscle, sural nerve, to the lower part of the back of the leg, lateral aspect of the foot, little toe. It accompanies vein which is called the short saphenous vein. The continuation of this nerve is called the tibial nerve in the leg. This is tibial nerve in popliteal fossa. Here's the tibial nerve in the leg. It starts at the lower border of popliteus, ends deep to flexor retinaculum by dividing into medial and lateral plantar nerves. They are going to supply the foot, of course. Muscular branches, we have 3 to 1, but this is 3 deep, 1 superficial. This muscle, which is called the tibialis posterior, the orange one is called the flexor hallucis longus, and the greenish one is called the flexor digitorum longus. 1 superficial gastrocnemius. So if we are going to concentrate, tibial nerve in popliteal fossa, it gives off 3 superficial, 1 deep. Tibial nerve in the leg, it is going to give off 3 deep and 1 superficial. 3 deep, tibialis posterior, flexor digitorum longus, flexor hallucis longus, 1 superficial soleus. So the soleus takes double nerve supply, one from tibial nerve and popliteal fossa and the other from tibial nerve in the leg. Cutaneous medial calcaneal branch to skin of heel. To skin of heel, this is called the medial calcaneus branch. Articular for the ankle joint. So the summary of tibial nerve. If you are going to see Gray's anatomy, for example, you are going to see that the tibial nerve, simply speaking, is written tibial nerve, not divided in tibial nerve and popliteal fossa, tibial nerve on the leg. So simply speaking, tibial nerve supplies muscles of the back of the leg. We have 3 superficial and 4 deep, 7 muscles. And muscles of the foot through medial and lateral plantar branches. They are each muscles. So tibial nerve supplies muscle of the back of the leg, 7 muscles, and the muscle of the foot indirectly through medial and lateral plantar branches. They are about 18 muscles. Cutaneous. It supplies the lower part of the back of the leg and the lateral aspect of the foot and the little toe, both of them through sural nerve. And skin of heel and the sole of the foot, skin of the heel and skin of the heel through this is the direct supply, and the skin of the sole of the foot through medial and lateral plantar branches. So these areas, I'm going to show you these areas. It is a matter of indirect supply. And these areas are direct cutaneous supply. So what about injury of tibial nerve, which is uncommon case? It is rarely injured. If there is injury, there is paralysis of all muscle of back of leg and all muscle of the sole of the foot are paralyzed. And the loss of sensation in the lower part of back of the leg, sensation of lateral aspect of the foot, including the little toe, and the skin of the heel and the sole of the foot. The form which is called the talipes calcaneovalgus. Talipes means the talus. Calcaneovalgus. Valgus means the distal part of the foot displaced laterally in this way. So this is called the talipes calcaneovalgus. This is deformities. This is talipes calcaneus. This is talipes calcaneovalgus. So it's called the talipes calcaneovalgus. So we finished the 2 plexuses, 3 nerves of the thigh, and this column tibial nerve. The final column, it is the peroneal nerve. We have common peroneal that divides into superficial and the deep peroneal. Common peroneal nerve, it begins in the middle of the back of the thigh, one of the 2 terminal branches of sciatic nerve. Common peroneal, it passes through the popliteal fossa from the upper angle up to lateral angle, then passes superficial to lateral head of gastrocnemius, then passes lateral to the neck of the fibula. And this is very important. Passes on the back or on the lateral aspect of the neck of the fibula, then it divides into 2 terminal branches that are called the superficial and the deep peroneal. These 2 terminal branches called superficial and the deep peroneal. What about cutaneous branches? No. Direct? No. No muscular branches. No muscular branches. Cutaneous branches, we have 2 nerves. Sural communicating. This nerve is called the sural communicating. We have sural from tibial, sural communicating from common peroneal, and the lateral cutaneous nerve of calf. Lateral cutaneous nerve of calf. Lateral cutaneous nerve of calf supplies the skin of anterolateral aspect of the leg, upper part of anterolateral aspect of the leg. Articular, we have 3 genicular branches, as tibial, 3 genicular branches. So muscular, no muscular. Cutaneous, sural communicating, and the lateral cutaneous nerve of calf for upper part of anterolateral aspect of the leg. This nerve divides into 2 branches, deep peroneal for the anterior compartment and superficial peroneal for the lateral compartment. Deep peroneal supplies muscles of the front of leg. They are named the tibialis anterior, extensor digitorum longus, extensor hallucis longus, peroneus tertius. And the one muscle on the dorsum of the foot is called the extensor digitorum brevis. So tibial nerve, deep peroneal nerve supplies 5 muscles. They are named 4 in the anterior compartment of the leg and one in the dorsum of the foot. About the cutaneous distribution, it supplies the skin between the big toe and the second toe, this area with yellowish coloration. So deep peroneal supplies 5 muscles for the anterior compartment of the leg, one in the dorsum of the foot, and the cutaneous for the skin between the big toe and the second toe. This is the deep peroneal nerve. Superficial peroneal nerve, its other name is called the musculocutaneous nerve. This is out the name. Superficial peroneal nerve, it passes in the lateral compartment between the peroneus longus and the peroneus brevis. It is going to supply both muscles, peroneus longus and peroneus brevis. In addition, it supplies a lower part of anterolateral aspect of the leg and the skin of the dorsum of the foot, except the 3 regions. SS, this is area medial for saphenous, this is area lateral for sural, and the peg is the gap between the big toe and second toe for the peroneal nerve. So again, this is called the musculocutaneous. Also, this name is great because it denotes supplies muscle, which is peroneus longus and the brevis, and finally gives the cutaneous distribution. For lower part of anterolateral aspect of the leg, most of the dorsum of the foot, except the 3 areas, the medial aspect, bisural saphenous nerve, lateral aspect bisural nerve, so you can memorize by SS, S medially for saphenous and S laterally for sural nerve, and the adjacent side between the big toe and the second toe. If we are going to collect the peroneal component as a distribution, common peroneal, muscular, no branches, muscular, cutaneous, 2 branches, sure communicating lateral cutaneous nerve of the calf for upper part of anterolateral region of the leg. It divides into superficial and deep peroneal. Deep peroneal, it supplies 5 muscles, 4 in the anterior compartment of the leg, tibialis anterior, extensor longus, extensor longus peroneus tertius, 1 in the dorsum of the foot, extensor brevis, and the cutaneous for the cleft between big toe and the second toe. About superficial peroneal, supplies 2 muscles in the lateral compartment, peroneus longus, peroneus brevis, cutaneous for dorsum of the foot, and all dorsum of foot except the 3 areas SS and the adjacent side between big toe and the second toe. So we are going to collect the supply of peroneal nerves, all of them, in form of common peroneal. So common peroneal has no direct muscular supply, but through superficial and deep peroneal, common peroneal supplies muscles of the anterior and the lateral compartment of the leg. Sensation, it gives skin of anterolateral, upper part of anterolateral aspect of the leg. This is direct, and indirect through common peroneal supply the rest of anterolateral compartment of the leg and most of the dorsum of the foot. And as I told you, except the medial and lateral aspect by SS, S saphenous from femoral, S sural from tibial. This is the injury of common peroneal nerve. I told you before, this nerve passes lateral to neck of the fibula. If there is injury to, if there is fracture of neck of the fibula, there is possibility for injury of common peroneal nerve. What's the effect of the injury? Paralysis to muscles of anterior and lateral compartment of the leg. Sensation, all sensation is lost except the SS in the foot. I told you before, saphenous and the sural nerve. This, except these 2 areas, the skin of the anterolateral aspect of the leg and most of the dorsum of the foot is lost. Deformity is called the talipes equinovarus. Talipes means the talus, equino means the horse. Varus, displacement of the middle of the distal segment medially. So it is called talipes equinovarus. Also, we can consider drop foot. drop foot is caused by sciatic nerve injury and also by common peroneal nerve injury. This is case scenario, and I think the proper answer is B, common peroneal nerve. I think this is talking about disc prolapse and the compression of sciatic nerve. I hope to my students in India and all native speaker in English to understand this lecture. This lecture directed to students who are speaking just only English. Thanks a lot and hope to see you sooner. Assalamu alaikum wa rahmatullahi wa barakatuh.